Hey y'all, yeah, it's late at night. Just thought I'd do a video. I haven't done one in a while. Uh, Hopefully everybody's doing good from this coronavirus. I've been seeing a lot of deaths from it, just within our state here in Louisiana. A lot of them in New Orleans. That's sad. People not doing what's being asked. As far as staying home, social distancing, that sort of thing. People are still going out. Uh, when I say going out, I mean to stores. Uh, yeah, if you have to for food and stuff, that's one thing. Bitching and griping because restaurants are closed or they're only doing takeout. You can't go in and sit down. It's just my opinion, but that's pretty damn selfish. Uh, just because you don't have it or you think that you're healthy, that you're not going to get it, that's pretty crazy to think that you won't get it. A lot of people won't. You may have it and not, and just be a carrier. You'll never show signs of it, but there's no telling who you've transmitted it to. So just keep that in mind. Quit being pissy about it. If you don't have to go to town, if you don't have to be in public, don't go. A lot of states are shutting down essential stuff. Uh, what they've got listed as essential stuff, I kind of disagree with. I don't understand how liquor stores are essential. We can all make jokes about it and this and that, but really, what does a liquor store have that's life saving? Uh, Real life saving. There isn't much in there. Uh, if you got to go to the store, go to the store, get your stuff, get your food, get your supplies, uh, get them and come back to your house or wherever you live, apartment, camp. I know a lot of people have gone to their camps uh, to increase the social distancing. A lot of people live on lakes, and that's where they're going. They're going to their camps up there. Uh, as y'all know, we stopped transporting about 2 weeks ago. My wife is a high risk. Not everybody is directly involved with somebody that's high risk. I'm glad you're not. There's a lot of concern with that, which is the whole reason why I stopped transporting for the time being. I'm probably going to make some people mad. Might even lose some friends over it. Hopefully won't lose any transports over it. It's just my opinion. So we'll just leave it at that. I think we were probably one of the first ones that stopped of groups that I know that transport. And I think the following week, a rather large one stopped doing transports. I kind of half-ass follow them through other people's posts. They stopped transporting. Another one that's nationwide, that's volunteer-based, they stopped transporting. Actually, they may have stopped transporting before me, or at the same time, somewhere right there, close together. Rescues are exactly that. They rescue animals. We do the same thing. Being that I have a high risk person in my home, uh, that really took a toll on our transports. Took a toll on just about everything that I do. Uh, the ones that don't have high risk don't think that you're immune to it. Uh, don't think that because you got somebody that's willing to come up there and bring in the dogs that everything's good. These people are going through about 9, 10, 11 states. A lot of these states between here and there are in bad shape. Uh, my biggest fear, other than bringing something back, was getting stopped somewhere away from home, uh, them, for whatever reason, quarantining me. Uh, Now what do I do with the dogs? Everybody in my vehicle would have been quarantined. Uh, Now I've got 15 to 20 dogs on the trailer. What are they going to do? They're going to send them to the pound. It's the only place they can go. More likely they're going to quarantine them too. So now we got drivers, transporters, and dogs on quarantine. A lot of people are still surrendering their dogs because of a scare. They think the dogs are carrying the coronavirus that can affect us. It's a completely different strain. We cannot, that's one of the few zoonotical diseases that we can't get from them. It just doesn't, their version doesn't live on us and our version doesn't live on them. Two completely different strands. So now what do you do when your driver gets quarantined? Or he's told that he has to park up due to a curfew, or they just flat out refuse to let him go any further in that direction. The owner of that transporter, you gonna take care of those people for as long as they're stopped? Are you gonna send them the money they're gonna need for food? Because that money that you just gave them to start is not gonna last. They've still got to take care of the dogs. Did you pack enough food for a month for the dogs? Enough water for them? Enough blankets, puppy pads, whatever you use in your kennels? Have you done that? Have you even thought about it? If you haven't thought about it, you're an asshole. If you are that greedy for money to send your drivers out into a world pandemic now, you're just a greedy fuck, is what you are. At least have some consideration for your drivers, because you're probably not going to pay for their hospitalization if they've got to go get treated. I'll be willing to bet you're not. So now you've exposed 2 other people or 3 other people or 1 person or whatever it is to that virus. Now on the way back, they've probably talked to 100 people. Who's to say those 100 people didn't get it? They just infected 100 more people. God forbid that it be elderly people or somebody with immune deficiencies, because they're probably going to die. The chances of them dying are pretty high. I don't believe all the numbers. People are panicking about numbers. If they paid attention when all this started, I'm not saying it's the truth. I'm not saying that what Trump puts out is the gospel. I'm not saying what his doctors and all those people have put out is the gospel, and what Italy and all these other countries have. Going off of what we've been told, they weren't testing everybody who thought they may have contracted this virus. They didn't have the testing kits for at that time. So they're only going to test the ones that are in the most severe conditions that met a very strict criteria. So these people get tested. We'll just say probably at least a quarter to half are coming up positive. So your numbers really aren't going to be bad. Now, as countries around the world, to include ours, work on better testing kits to get faster results, more accurate results, hopefully it tells them how they can treat it and they can move forward. So now once you get that, now you've got more tests, now you can test more people. testing more people is going to cause your numbers to skyrocket. I don't understand why people are panicking over that. They're saying we got more and more cases here and we got more and more there. New Orleans is basically just a graveyard. The time when all this started, we didn't have all the testing kits what we got now. Not saying there's enough. There definitely isn't. More and more people are being able to be tested. The criteria is still there from what I'm seeing, as far as what allows you to be tested. You know, as they get more tests and as they get better results and as they get better tests, better ways to treat it, your numbers are going to go up. If you start out with 10 tests and you do these 10 people, and now next week you got access to 200 tests, your numbers are going to go up. It's inevitable. Numbers are going to go up, and in some cases they're going to skyrocket depending on the area. How many people got infected, how many tests they've got, test kits they've got to actually do them. So, I don't understand why people are panicking about that. We were at the start of this virus outbreak. Numbers are going to be low. There is going to be a point when they're extremely high, or what some of us would call extremely high. And then, like everything else, it's going to taper off once they get control, they get a treatment for it, and that number's going to start coming down. They'll have a better idea of who's being infected and why. More accurate symptoms on it. Everything will improve over the time that this takes place until we can get it under control. And basically all the countries in the world are open back to normal business. So I don't understand why people are panicking about numbers going up. Everybody's in a fit over because the U.S. just passed Italy. Well, we got more tests. More people got tested. You get more people tested, your numbers are going to go up. There's no way around that. You start testing more people, your numbers are going up. Doesn't matter what you do, how you prevent it, or how you think you're trying to prevent it, numbers are going to go up. Are they going up pretty fast? Yeah. Is it a shame? Yeah. A lot of the states have asked for people to shelter in place or at home. People are still piling up in the stores. Yes, I have gone to Walmart. Most of the time, actually probably about every time, has been for medications for my wife. Now, while I am there, I will try to pick up whatever I can, whatever they've got in stock, and I leave. Not hanging around. I don't need to take that chance to bring it back. So your transporters are out there on the road. We'll go back to that. Your transporters are out there on the road. They're stuck somewhere between here and there. And you're not doing nothing. Because probably what some of y'all are going to say is they knew the risk. They knew what they were getting into. Well, that may be true. But you, as a boss, should have enough common decency running through your veins to tell you people, no, we're not going to do this. Because if your drivers go down, you get that virus in your vehicle, it stays there for a while. Now you've got infected vans or trailers or buses, whatever people are using. Gooseneck trailers, your vehicle, your trucks are going to be tainted. Not really an easy way to kill it. I think the easiest way they said that it dies, or the fastest way they said it dies, is sunlight. It cannot live in the sun. Florida, they were saying in the beginning that Florida Once it starts getting warmer down there and staying that way, will probably be one of the states that starts getting rid of it sooner as far as the virus being out, uh, on surfaces, outdoor surfaces, stuff like that. That's what they were saying. Now, of course, all that stuff could have changed. Uh, who knows? A lot of people don't. When it all started, they didn't know how to treat it. They didn't know what it was. They didn't know what it was affecting. Unfortunately, somebody had to die, so an autopsy could be done, and they could see what damage it did. It's a shame that it works like that. It's no different than OSHA making what we all call stupid ass safety rules, but it's because some idiot already did it and probably killed himself or lost a limb. They've made the workplace safer. It's kind of the same thing. Unfortunately, people are given the ultimate sacrifice, which is their life, to hopefully improve a treatment within their countries, whatever nationality they were. That stuff takes time. It's not going to happen overnight. Am I saying that people knew about this long before it became a pandemic? Probably. The only one that knows is the person that had the very first case. Nobody's going to admit to it. We all know that. We can point fingers. We can do this. We can do that. Doesn't matter. It's easy to point a finger at somebody. People point a finger at Trump. And before I even get started, because it's the second time I've said his name, I don't like everything he's done. I've never said that he would be the best president. But the thing he's got going for him is he ain't a politician, and he don't give a shit what politicians think. He's a businessman, and that's exactly what he is. Now, somebody will twist it, saying, yeah, he's doing it because he's making money. He's president of the United States. Whether you like it or not, he's it. Thanks to the Democrats, will probably be the president of the United States for the next 4 years, too. Now, I don't know how many of y'all have been involved in a crisis like this, maybe not of this magnitude. Any supervisors that worked overseas, whether it be KBR, Fluor, a couple of the other companies. Some of those incidents are pretty tough to be able to put out information and not say too much. I've been in those situations a couple times, and it's not easy. I'm usually not the one that's politically correct. I'll be the first to admit that. But you got to understand that these leaders of these countries are trying real hard not to throw a scare through the entire country. They're trying to give everybody the information they need. May not be what they want to hear, but tough shit. It's never really what we want to hear. And they shouldn't be telling us what we want to hear. They should be telling us the truth. I'm not saying they are, not saying they're not. But you got to understand, this man is in charge of several millions of people that he is trying to keep calm. So all these doctors and hospitals and urgent cares and everybody else that's helping out with this can actually handle the crowds that are going to be coming in. So you're not just going to come out and say a whole bunch of stuff just because that's what somebody asks. You're not going to do that. You still have to maintain not really control. But you need to be the one to reassure your people that things are going to be okay. This is what we need to do. And everybody needs to do their part. If everybody does their part, things will be a lot easier. Now, we all saw in the beginning where people went out and just bought every damn thing in the stores. There's a lot of elderly people who can't go. They've got to call somebody to come drive them. So by the time that gets arranged, everything's gone. You got people stocked up with 200 rolls of toilet paper sitting in their house and they live by themselves, just being greedy assholes. Medical people that are in their home taking care of themselves, or spouses or significant others taking care of them in their home, that need normal supplies that they can get from a Walmart, a Walgreens, a Sam's Club, that sort of thing, other than basic groceries, and they're all gone. And you got some asshole sitting down the street, sitting on all that stuff, just waiting to make a buck off it at somebody else's expense because they are in desperate need for it and probably have to have it to keep themselves sterile or in a clean environment. Hopefully it doesn't get worse. Hopefully, I'll put out a post twice. There's a lady that was part of another rescue in South Louisiana. Her 4-year-old son has COVID-19. Her job was babysitting. She can no longer do that. She cannot leave her house, so therefore she can't go get groceries. Even if she could, there ain't gonna be shit in the stores because some assholes already went through there and raked all the stuff in his car. And we couldn't get anything. I do understand times are tight. I do understand that people are scared, and justifiably so. Scared, yes. Panic, no. To me, there's a difference. Do what you need to do to take care of you and your family. Get the supplies you need. Thankfully they've left the stores open where you can go get them when you need them. Just don't abuse it. Let some of these other people get the stuff that they need. For their homes, for their families. Well, I'm glad to see some of the stores opened up an hour or two before to let their employees that work all night stocking the shelves for you assholes to go in there and just clean everything off in 20 minutes. I'm glad they let them go shopping first. I'm glad they're letting the elderly go in an hour before they actually open to the general public. At least they have a shot to get what they need. Elderly, you're probably not going to see in there, but probably 2-3 times a month. But you have somebody that's young and healthy, or claims to be young and healthy, going in there buying up everything so they can take it back to their house and they can hoard it. And then they'll be putting it up on eBay when all this stuff is over, trying to sell it. And I'm glad all the stores put up that they anything that was due to this virus, they cannot return it. I'm glad. Now you're stuck with it. Unfortunately, you just put other people in a bind by doing that. I know one other person right off the bat that is a very high risk. They can't get stuff either, and they're young, about half my age almost. So it's not just old people. I seen the clip where that stupid ass licked the toilet seat went on spring break. She told Dr. Phil, now I'm not a great fan of Dr. Phil, so don't get me wrong. She's telling Dr. Phil that the only reason that people his age were worried about it was because it was affecting them. Kids her age shouldn't have to worry about it. And this is, I think she said, a senior at Rutgers. It's got to be the dumbest college student I ever heard in my life. To think that she's not going to get it and she can still go out and do whatever she wants. That's a pretty impressive level of stupid there. Take care of the people that you got around you. because a lot of people are starting to figure out real fast that some of these people that are getting it, they know them. Somehow, some way, they know them. The lady in the rescue, I know her only because of the rescue. I've never met her. I do know the rescue president, but I don't know that person. So I guess that kind of makes it as me knowing somebody. So now they're saying, now I saw a flyer going that National Guard's coming out. You got 48, 72 hours, get all your shit being locked down in the house. Quit spreading that bullshit until it comes out from a reliable source. What you're doing is contributing to the fear that's going around, especially in some of these small towns that don't have a Walmart, don't have a Walgreens, stores like that. Quit spreading that bullshit. When it happens, it happens. The more they get people not following the rules they put in place, the closer we're going to get to it. So, now I'm not saying, don't go to your camp. I'm not saying that. Stay the hell away from people. Don't go up in these busy ass stores, because Walmart here ain't changed. It's still just as busy as what it was 6 weeks ago. Same thing with the one down the road, the next town. Just hasn't hit them yet. We've got cases here. I think there's 2 in Leesville. I'm not sure about that, but I think there were a couple cases in that parish. I heard that there was some in the next parish south. I don't know. I haven't seen anything that I think is trustworthy. Just be real careful on what information you start spreading, whether it's flyers or pamphlets or whatever it is, because if it's not true, it's not accurate, you're contributing to the fear mongering. You're going to cause people to panic. It's going to get people hurt. And you're going to cause other people that desperately need the supplies not to get them. So just keep in mind when you start spreading all that stuff all over Facebook or, person to person, text messages, messenger, whatever the case may be, however you communicate nowadays. Be careful what you're sharing, because some of that information probably is not true. Take it from your governors, the president. Take it from them. I'm not saying they're honest. I'm not saying that everything they say is truthful. Take it from them. Don't take it from some asshole who's just trying to start a panic in his town because he thinks it's going to be real funny. There's nothing funny about 100 people crashing through a door of a big store, people getting trampled, hurt, killed, houses getting robbed, robbers getting shot, because that'll happen around here. I promise you that'll happen. Don't play into that. Pick whatever source you think is telling the truth, and don't just look at every single one and say, "Oh, yep, that's the truth." You start freaking out about it. Find one that you feel is accurate with everything that's been going on, compared to what your governors are saying, compared to what the president's saying, information, you see it. If all that's kind of jiving together, it's probably going to be close to accurate. It's a bad situation. Don't make it any worse for the ones who are truly scared and wondering how they're going to keep their stuff, wondering how they're going to survive through it when every time they go to the store they can't get anything. Don't be that asshole to be taking the supplies that they need. and they truly, truly need. Uh, you don't do that. My wife's on home dialysis. I hook her up every night, and we've got to have masks. They called her before this ever really got good and kicked off and told her we needed to take it easy on the masks because they were not sure if they could restock her. Uh, these are the kind of people that are going to be the ones doing without. These are going to be the people that are going to be dying in their own homes doing what they're supposed to be doing, and because some asshole went out there and took everything off the shelf, they can't get it. So think about that. You know, if that's your grandmother, your grandfather, your diabetic uncle, uh, you're going to want them to have the stuff, and you're going to be pretty pissed off every time you go to the store and you can't find the stuff that you need. Your supplier for your medical needs just doesn't have it. I guess that's kind of when the realization set in for us, as far as the seriousness of it, was when they told her that we needed to we needed to try and save on our masks. Uh, you know, we're talking about making connections. We got exit sites from a medical procedure, stuff that has to be cleaned a certain way. Uh, you know, so that kind of makes reality set in pretty hard. So you're going to know somebody that gets it. Whether it's through somebody on your friends list, a group that you're part of, whether it be rescue, whatever it is you're part of on Facebook, you're probably going to end up knowing somebody that got it. Uh, just to touch back on the rescue side of it, it is what it says. We all want to save every animal that we're respected, that we're trying to save. I get it. But do you really want to be the one or the reason that driver is now in quarantine, who has now come down sick? Because lately, it hasn't been just old people. I heard of a 17-year-old that got it and died. I know of a 4-year-old that has it right now. Lots of elderly. This virus is not being picky on who it gets. You know, so just do the right thing. If you're in a small community, we've got a bunch of them around here. Take care of your communities. Yes, I did offer to cut people's grass. Am I essential? No. If I were to be stopped and told to go home, would I? Yes, absolutely. The reasoning behind that, whether it's a good reason or a bad reason, was because a lot of people that I know have kids and they're home from school. They don't want them outside, you know, not very long. They don't want them to take a chance in getting exposed. So yes, I did offer to go cut their grass so they didn't have to worry about it. Elderly people, they don't need to be coming outside. You know, not unless they just absolutely have to. Them coming outside during this time of year in Louisiana, them getting sick, it's going to be a pretty good chance. They don't need that. So, liquor stores, I don't see why you're an essential service. Storage facilities, I really don't see why you're an essential service. Lawyers' offices, don't really see that. Doctor's offices, yeah, my heart doctor, he done closed his office till further notice. You know, it's a shame that everybody stands behind people like Colin Kaepernick, who is just so oppressed that he wants to kneel for the national anthem because he has no fucking respect for anybody. People like Mike Vick, who really hasn't done anything for the country at all. Neither one of them. Both of them combined haven't done anything for the country. And the ones that are being asked to basically keep this country going, there's nobody that's making $1 million individually. Nobody that's making $1 million, $2 million, $500,000, $750,000 a game. They're making probably 60. We'll go on the high end of 75,000 a year to deliver your fucking goods, and they're all blue collar workers. Funny how that nobody wants to give them any praise. 2 months ago, everybody's cussing them. Oh, they take up too much room. Oh, well, they're the reason why we have so many accidents. Oh, well, they're just trash. Look at them. Look how they're dressed. And yet, they're the very people who have openly volunteered, told their bosses that they will continue working, whatever their job is. I've heard of a couple car manufacturers that said that they can make ventilators. They'll shut down their cars and they'll start making like a mass producer, probably just as fast as they need them. That's 2 major car manufacturers. Look at your trucking companies. All these people that are driving those trucks, they've all got families. They've all got significant others. They've all got kids. Most of them probably got kids. They chose to leave their home every week or every day to still continue to bring supplies to stores so greedy assholes can go in there and take everything off the shelf. You don't hear anybody praising them. I've seen a lot of individuals opening their homes for them, offering to go through drive-thrus to get their meals for them. I know I'm forgetting one. I know 2 right off the bat that drive through my area. One's a cousin and the other one's a best friend from the Army. I've told them flat out, if you're close, come see me. We'll get you a hot meal. You can take a hot shower and you can take you a nap for a while if you want. I've seen some do that. But country as a whole, we haven't even started thanking those kind of people. We haven't even started thanking these nurses and these doctors and these hospitals that have had to stay, who probably haven't been home in a week, because they are trying to find something that works and get a consistent treatment going so they can start saving more people's lives. This country wasn't built on some rich motherfucker sitting up here in a big old house on top of a hill. This country was built on people plowing fields, people driving trucks, people flying planes, and I'm talking about freight. Leonard, no offense to you. This country was built on. Blue-collar people that literally, through blood, sweat, and tears, produced a product or carried the product to somebody for somebody else to use. So your farmers are still working. Your truckers are still working, because I can tell you, if the truck stop, we're in a bind. We are in a bind. Shit will go south fast. So if you do see one of those truckers, if you do see a pilot just brought in some freight, you see a nurse, well actually any first responder, city officer, deputy sheriff, state police, nurses, doctors, nurse practitioners, CNAs, might want to thank them. They could be the very people that keep this country going long enough to get it back opened up. As a matter of fact, they are going to be the very people that keep this going. It's not going to be the assholes like Kaepernick and Michael Vick. It's not going to be those people. going to be the people that are wearing blue collars, t-shirts, and jeans. Shoes is probably optional for most of them. My sister has a farm. They provide that they actually sell their crops to people, to stores, I do believe. They're contributing. So you might want to think long and hard about that nasty looking guy that just walked into a store after a long day out in the field, or the guy who just fixed a truck so he can get back out on the road who's covered in grease. You might want to look at him a little bit different, because without those people, it's not going to be good. So just keep that in mind. Don't panic. Look at your source for your information. Do a little bit of research anyway. If you got friends in the medical field, ask them. Send the post to them. Whatever information you find, ask questions. I do. So just be real picky on what you're sharing as far as information on all this. You don't want to be the one that's going to be causing a panic in your town because you're spreading bullshit. If you are really not an essential person to be out, don't go out and don't send your people out in it either. Don't be that greedy for a buck. So just be sensible. Take care of yourself. Wash your hands. Yeah, we hear it all the time. Wash your hands, wash your hands, wash your hands. Don't go out in public and gather with 50, 60, 70, 80 people. Think you're going to, always, every single time come out of that unscathed. It's need to think. People need to start thinking. It's real. People are dying. More people are dying. And it's not going to end tomorrow. So just keep that in mind. Be sensible. Get what you need and stay home. Stay away from public. Like I said, you may not have it. You may not think you have it. You could be a carrier. Most carriers of diseases never get the symptoms, but they can give it to you or me just as fast as they got it. So look out for them. Help the elderly, whether they need grass cut. They need you to make a run for them to the store when you're going. Pick up some prescriptions if you can for them. Do that for them. Help them out. If you've got the space to make a food bank to help somebody, do it. Maybe your neighbor. You're thinking, oh no, I'm keeping all my stuff for me. Well, you might be the very person that someone's trying to help. Just keep that in mind when you get pissy about it and you want to hoard all your stuff, and now people don't want to hoard you or help you because 2 months ago you had 300 rolls of toilet paper and all the sanitizer and bleach and everything else, and nobody else had it. So just keep that in mind. Take care of yourself, take care of your families, and we'll make it through it. Just don't panic. Research your information sources, and don't be spreading the bullshit. So hope everybody stays safe, does everything they can not to get it, and hopefully we'll start seeing a downhill trend in this here over the next couple weeks. At least I hope before the end of the month, or end of April anyway. So, all right, well, I appreciate y'all listening. I know this one here was a little bit long. Just been some stuff that's been bugging me. Just thought it needed to be shared. So, appreciate y'all. Go to our page, check us out. We do have dogs that are available for adoption. Get with my wife, Jimmy, on the adoptions. She'll help you out. She'll let you know what the steps are to get one. And we'll get on it and figure out a way to get it done. So, thank y'all. Y'all have a good night. At least now everybody can catch up on sleep and spring cleaning. So, thank y'all.